My name is Ian, and I'm a pharmacy intern here. I'll be helping you out with the glucose meter recommended by your doctor. Can I confirm your full name?
My name is Daniel Rosales.
And then your date of birth?
9892.
Perfect. All right, I just want to give you a quick overview. It'll probably take about 10 minutes to get through all the details that we're going to work through today. Hopefully you have that kind of time, and if I have your permission, we can go ahead and get started.
Yeah, absolutely.
And then I also want to ask you permission. Do you mind if I touch any of the components just to show them to you? Because I know this is yours, so you take on.
Please do.
All right. Can I first ask, what did the doctor tell you this was for?
This is going to be used to be testing my blood glucose.
Yeah, that's exactly right. It's going to help give us an idea of what your blood sugar levels are looking like. And then, can you tell me, how did the doctor tell you how you're going to use this?
I don't know much, but I know I'm going to be poking my fingers, and that makes me really nervous.
No, of course. No, it's a really common concern. A lot of people don't like the idea of drawing blood every day. But I'm going to go ahead and show you a few techniques. I have been over this with a good number of patients, and I can tell you all of them, they get really comfortable with it. It's not a painful process. It's much less painful than they always say it's less painful than they expect it to be. And again, you're going to be doing it just once a day. So hopefully, that gives you some kind of peace of mind, but then also we'll teach you some good techniques as well. Again, that's once a day between getting up and then between your first meal, or the first time that you eat. And the prescription that we have is for 1 meter, and then along with 100 test strips, and you got 3 refills on the test strips. Okay, and did the doctor go over any kind of instructions about how to use the meter itself?
No, not really.
Okay, no, well, and that's what we're here for. We can help you out with that. So all the individual components we have laid out here. So this is the meter itself, along with the lancets that I will show you how to insert into the lancet device on its own. And then we also have the test strips as well. And then first, before you ever get started, you always want to make sure that you wash your hands, make sure everything's clean, and that you're also looking at the expiration date here, making sure what you're about to use is expired for the test strips. And then a quick note about the sites that we're going to look at to prick our fingers to test our blood glucose. Anything that's visible when you put your hands together like this, right? So the edges of the tips of your fingers, anything that's visible there is a viable option that we're going to go for. It's better to use the tip to these edges because it's not going to be the pads of your fingers, which we use really often and are going to be a little bit more sensitive to pain. And then you may have heard that some people will use it, will test their sugar maybe on the base of close to the base of their thumb or on their forearm. It does happen, but those results are a little bit less accurate. There's up to about a 20-minute delay for an accurate reading on blood glucose, so it doesn't give you real-time information on that. So for now, we're going to stick to our fingertips, and if we have problems with that, we can maybe look at alternate sites down the line. But for now, we're going to stick with fingertips. Okay. And then it's always a good idea to make sure you get your meter set up first before you start, getting involved with needles and pricking yourself. Make sure we got everything ready to go. You're gonna go ahead and take a test strip, and you're gonna go ahead and notice the silver contacts here. That is gonna go face up, and that end is going to go into the meter itself. It's going to turn on automatically when you insert it, right? So now that we have that set up, we're gonna go ahead and ready to load the lancet into the lancet device on its own. You're gonna pull it apart right there. And then the lancets, which again are the needles. The needles are underneath the circular end here. You can leave that on until we're ready to take it off later. You can go ahead, insert it like that. The circle end on top. And again, you don't have to really jam it in there. It'll make it really difficult, a little more dangerous to take it out later. And then before recapping it, we're gonna go ahead and twist the top like this. You can expose the needle. So at this point, you should make sure you're aware of where it is so you don't prick yourself accidentally. We always like to do it deliberately. And then you go ahead and close it till you hear that snap. All right? And then to prime it or really get it ready, you're gonna pull it back till you hear a slight click. And now you know that it's going to be ready to hold up close to your finger. I'm not gonna demonstrate it right here, but once you have it in a secure spot on the edge of the fingertips that we talked about, you're gonna go ahead, press the button. It's so small, so fast, you don't even really see it. I don't know if you caught it, but that's really all there is to it, just for the finger pricking part. And then once you have the blood that's collecting on your finger, you're gonna go ahead and touch the very end of the contact to the blood that's collecting briefly and then take it away with that same amount of time that I just showed you right there. It's important to realize it's not necessary to try to put a drip on top of the strip, and it's not necessary to maybe like try to apply the blood, you know, with the meter itself like this. Also, you never need to do like a second application. You don't need to ever wipe it off with alcohol beforehand, and also make sure that you never reuse the strips. Always, for each use, you'll have one use strip. And then that reading will automatically be recorded. So the blood glucose level, along with the time and the date, that'll be taken care of automatically for you, up to 500 readings, and those will be available to access by your doctor, for whatever information that he needs on his end. And to dispose of it, you can put these guys out in the regular trash. It's not dirty. I'll put it out into my hand right now, but you can press the eject button right here. And then for the disposal of the lancets, I'm going to make sure that we have, thank you, a hard-sided container that you can, with a tight lid. You can open it up. And again, you can carefully remove this guy. And once your container is full, you can seal it again all of the way, and it's never a bad idea for extra security to seal it up with tape, and that can go into your regular trash. You can also find a sharps container, which will be similarly constructed, red on the sides, with a closable top. That'll be available at any pharmacy. If you any pharmacy that you walk into, it'll be readily available. They'll be able to help you find it if you need help tracking it down. So, just to make sure that I've explained things clearly, can you tell me how you're going to dispose of your strips and your lancets?
I think you said the strips can go in the trash and the lancets will go into the puncture-resistant container.
Yep, that's exactly right. And that puncture-resistant container can go right into the trash as well. Okay. So then how do you normally store your medications?
I usually keep them in the medicine cabinet in the bathroom.
That's a very common place where you can, where people tend to keep their medications. Unfortunately, in a case like this, and also with most medications, you want to keep it away from moisture, and the bathroom can have a lot of moisture. So if it's someplace, dry at room temperature, maybe high, away from pets and children as well is helpful. And then you also want to make sure that you keep it, don't put it in the fridge or the freezer. You want to make sure you keep it out of direct sunlight or any kind of exposure to extreme temperatures. And then quick heads up, I was talking about the expiration date before. Also make sure, once you open it, it's good for 4 months after that, or until you see the expiration date, whichever comes first. So other than that, what did the doctor tell you to expect with the treatment of the medication?
I think he told me to expect like lower glucose numbers in the morning and higher ones in the evening.
Yeah, that's about right. So ideally, the goals that we're looking for is that between meals, you're gonna hit about 80 to 130, and again, that's milligrams per deciliter, but the values that are showing up here, it'll make it easy to identify those numbers. You don't have to worry about the units too much. They do that on purpose. And then again, that's between meals. After meals, you want to be seeing levels ideally beneath 180. And again, these values are helpful for the doctor if he ever needs to adjust or just make sure you're getting the right amount of insulin at the beginning of the day, for instance, or to gauge your own metabolic response to any different types of meals that you're eating throughout the day to give you an idea of how your body responds. Okay.
I have very calloused fingertips. What if I can't get any blood out?
Oh, right. Yeah. Let me show you one more thing. These measurements here, 1 through 5. Again, 1 is going to be the most shallow part of the knee. They control how deep the lancet goes into your skin. So I would suggest starting out at 1 or 2. That's going to be the shallowest end. And again, because you have calloused fingers, if the 1 or 2 isn't quite getting you enough blood to be able to wake and get a reading, you can go ahead and start moving up as needed.
Okay, good to know.
Okay, and then just a couple of things to look out for. I want to make sure you understand it's important not to share your meter or your lancet device, or definitely any of the lancets at all, with another person. It's going to be just for you, for the sake of safety. Blood is involved, and then also just for the lancets, same thing as the strips. You don't want to reuse those at all. You want to make sure you want to prevent any kind of risk of contamination or infection, or dulling of the lancet, which can, for some people, produce more pain. And then just one last thing to look out for. If your blood glucose levels ever read above 400 or less than 70, that's a really good sign that you need to inform your physician as soon as you can. Alright, what questions do you have for me?
Oh, I think you covered it all.
Okay, great. Well, if any questions do arise, you have my number in the main pharmacy. If you have any questions or concerns, especially about anything that we went over today, I know it was a lot of information.
Thank you.
Thank you for your time.